Thank you so much for taking our call.
Good morning, Chris.
Sabrina here as well. We just kind of wanted to follow up. You made the presentation a couple days ago. I don't like that you're right, but we are seeing the numbers that you kind of said that we would.
Yeah, and so we so far are seeing it again. That the data is still not as robust as we would like to make more accurate predictions. But there's enough information there to show that we are still essentially on the same curve, and that our efforts are still very much needed throughout the public to be strictly adherent to the governor's orders and to really take this seriously.
Yeah, it's so disappointing when you still go out there and you see so many people that are still out and about, and you're right, not following the governor's directive to stay home.
Yeah,
I mean, I'm trying to figure out what else can we do.
Well, we could send the soldiers out in the streets. That's what we could do. I think that would really send a good message.
Yeah, and we had a discussion about that during our last conversation about tanks in the streets and so forth. But I think at the very minimum a presence, in terms of even if it's not just the National Guard, but even just our patrol, our GPD's patrol, but they're also limited in numbers and they have their own adjusted protocols as well.
Right.
So that's something that we would understand. I was just getting updated on my news on Reuters this morning, and India. Oh my goodness, they're using switches, they're spanking people in the public, literally, with.
I support that.
Sticks.
I support that. I'm big. That's executive order. Let's do it, Gov.
Yeah, and not just that, but then they're like making some of it's not that cool, but they're making them do squats or do push-ups as punishment for being in the streets. And that seems excessive, and there's can be a lot of debate on that, but it's but they themselves are taking it extremely seriously. You can imagine, because of the sheer number of citizens they have, and the lack of testing and medical facilities they have there, that there's a delay in what they're seeing compared to the rest of the world, but it could get very, very serious there very quickly.
Mm-hmm.
Doc, there was a thing in the Joint Information Center release here that Sabrina,
that the medical operations team issues an important medical advisory as a result of the accelerating numbers of positive cases. It says, consider yourself possibly exposed if you recently traveled or attended any mass gatherings such as church, fiesta, small parties, or gatherings within the past 14 to 30 days.
Yeah, and again, that just really emphasized the blanket statement that everybody has to assume that everybody else has it, and to be cautious of that, and also to assume that you have it, and that you are a likely person who can spread this to the vulnerable and the sick people, and that's in particular the younger generation, that they are the ones that are the most dangerous at this point. So I think that's what that really highlights, and it just gives people more of a way to kind of view themselves, because that pretty much describes everybody, right? In one way or the other.
Yeah, good job.
So yeah, but the one of the things, and I was able to listen to a little bit when Dr. Tom Shea was on earlier, and he's absolutely right. That this virus, what it does is that it preys on what makes us human. It preys on our most valued social and cultural values, and it uses that and it weaponizes that. And that it takes away what we do to connect as humans, and as a way to defeat it, but rather it uses it as a way to spread it. So it's tough, and everyone I know is having a tough time with this. I myself am, with my own family, and not being able to see them and interact with them the way I want to, and I can't wait to do again. But it's something that I'm making the personal sacrifice, because I know how important it is. And as I said this over and over, I would never ask the public or any of my patients to do something that I wouldn't do for myself or my own family.
Mm-hmm. I noticed, earlier we did try to connect with you, but you mentioned that you were in a conference call with the Federal Emergency Management Agency. Is there anything that you can share, or even just generically speaking, their involvement in Guam's COVID containment?
Yeah, so I was part of a group that we were listening into the call, not necessarily a main participant of it, but what it was it was a conference call throughout all the main areas throughout the Pacific, so including Hawaii, of course, the CNMI, American Samoa, and so them giving their status reports of where things are. So it was very, very helpful to listen in on that, and then kind of understand what the status is for them and what their needs are. And of course, a lot of it mirrors each other, but you can only say so many things during a phone call. So what they choose to say is actually very, very, very important. I've been just yesterday. I was also in contact with Dr. John Tadella, who's the chief medical officer for the hospital in Saipan, and he's also the advisor to the governor for in their readiness and their preparedness. And so, and he and I have been just discussing in terms of the challenges and what are the things that we're learning here, in particular for Guam, and how that might, apply, and how they might be able to be more proactive in the CNMI as well.
And in the CNMI, they don't have any confirmed cases there. And that I'm glad you mentioned that, because there was something that Tomas Manglotnia, he's been following what's happening in the CNMI, and he called us, and it was the first that he heard that tests were conducted or sent to Guam and repackaged to be sent off island.
Right.
And that we couldn't do the testing for them here.
And so what he was able to find out was that Guam is actually designated as the test center for I think the region. I'm not sure if it's Micronesia or what region it is, but tests should have been done on island here. Can you confirm that? Is that the case?
Well, I'll tell you what I do know. And so in terms of the so yes, they themselves have also they have the same PCR machine, the Gene Expert, as both public health and also that GRMC has. But again, we're waiting for the kits for that. They're also getting their ABI 7500, which is from the CDC, but that's yet to run. So until that happens, and the timeline for that is really up in the air. Guam is the designated center for where they will be sending their samples, and they have sent samples, but Guam Public Health is still using the same criteria to and prioritizing their samples based on the details of the patient that is being sampled. And so it meets the same in terms of how they triage and who's high risk and who gets to be tested. So it doesn't. So in the end, it's not like Guam gets first priority for those tests. If there's a very sick patient in Saipan that they absolutely need to know, because it will really change the whole management of not just that patient but the entire hospital, then that gets prioritized as well. And so so that's currently the situation. I am not aware of Guam sending further those samples away. In fact, Guam Public Health has not done any of that. That they've kept them in the queue, so to speak. And with these new guidelines that they put on for the rest of the medical community in terms of better understanding of the priority of testing, they've actually been able to get more caught up on their backlog of tests, even those in the medium and even lower priorities, is my understanding.
Well,
and I think that was reported yesterday.
Doc, we spoke with Lillian this morning, and you're talking about the priority testing. She said that the limited priority testing for the people at GMH, that GMH is everyone that fits in those categories has been tested.
Yeah, and that's my understanding. And then again, because they also have a number of samples from the community clinics as well, right. So those are all put in the queue. And so the CNMI, they're also having, because there's limited cargo flights that they can have, basically the United flights, and my understanding is that that's actually going to be reduced further, and so then that's going to limit their ability to send samples to us. and so they're looking at other options, including potentially Star Marianas to assist with their ability to send.
We could fire up the Suckman too if we need to. And I got a lot of friends in Saipan, so we kind of wanted to ask. They haven't had a confirmed case yet, but and I know you probably have many relatives and colleagues there as well in the NMI. What is the thinking of the doctors there? Do they believe that the COVID-19 has already been spread around and that we just don't have a finger on it because of the testing capabilities?
Yeah, and so for those not aware, that I'm actually from Saipan myself, born and raised. I do have a vast majority of my family still on Saipan as well, and I communicate with them frequently, as well as my physician colleagues there. And yeah, so the sense, and I'm very happy to hear, especially amongst the physicians, is that they are assuming that it's there and that it's been there, and that they're and right now they're being extremely proactive in terms of what they're doing to take precautions, which is, I think, very, very good. But there's there's still a sense that the public is not taking it as seriously because there isn't yet that first positive that's confirmed. So there is so if in a sense that that puts their testing samples in a different priority level because of their overall public health safety is how I would view it. And I wanted to share this, and I actually did. When we spoke, gosh, that feels like forever ago, but I guess that was 2 days ago when I was on air, and I listened back in. An hour later, there was you guys were doing a beautiful tribute for Auntie Doring, and I left a comment there, and it's something I had said multiple times, and that Auntie Doring, who for those who aren't aware, was our first COVID death here in Guam, is that her death actually, I believe, very strongly saved many, many lives. And it's because it brought a different reality to this disease. She allowed us it brought us a face to the disease in terms of somebody that we can relate to, that a lot of people relate to, and sounds like a lot of people love very much. I've never had the privilege of meeting her, but she sounded like a wonderful woman. And of course, my mom on the side starts texting me. It's like, oh yeah, I know Auntie Dawn. She was, and then of course I have to show how I'm related to her somehow. And so she went to the lineage of how, yeah. And so
right.
your distant cousin was married to her, and blah. And so. But they really made it very, very real, and it brought us our sense of community, and I think that was so important. And yes, we're not going to be able to mourn her in our usual customary values and practices, but I think that we're like any other culture, we evolve, and just the outpouring on social media is just a beautiful part, and it really helps. That really I think helps people take this much more seriously. The more lives are going to be saved, and I'm forever grateful for her for what she's sacrificed for us.
I think I saw that comment, Doc, and I read your bio. I know you're from Saipan, and that's why I kind of wanted to ask you, because I know you got the connects there, right? Mm-hmm. And so I'm pretty sure like they're calling you all the time, and so we just kind of wanted to get your take on it, because we're talking with Tomas. But he's taking it seriously. Our friend Tomas Manglotny, who's done some reporting for us, he's not leaving the apartment he's in. So he's gathering information over the phone, and that's why we kind of wanted to ask you, what are the doctors there in that MI saying? Yeah.
So far, at least the ones that I've heard from, I'm happy to hear about that. And I'll be honest, I expected nothing less from them, because there's some really, really great physicians there, mm-hmm. and Saipan's very lucky to have them.
When will the FDA waived test kits be on island? Do you know anything about that, Doc?
I still don't know. I was actually trying to look for an update this morning, and we still don't have a specific update on that.
I did want to follow up, and when we talked last time, we were talking about whether or not the military had to, report to the government of Guam about their cases of COVID.
Yeah.
And lo and behold, that afternoon a question was asked about 4, and then the military denied it, and then yesterday it was, we have 4, confirmed cases, and they're coming from the USS Theodore Roosevelt. I wanted to ask, because people are concerned, and can you tell us how concerned should we be if the military decides that they're going to fly out soldiers, more sailors from Theodore Roosevelt, or even pull into Apra Harbor or wherever? How concerned should we be?
That's a good question, and but what I think is I'm reassured by is that that the military here is, there's still some, especially when you're not on base. Of course, they're following what's the governor's orders are, the executive orders. In particular, they themselves have some other of their, for example, for U.S. Naval Hospital and their physicians who are returning to island, that they are also undergoing quarantine, even though they're active duty. And so that's something that they are taking seriously, and they are complying from that standpoint. And so I don't know more of that detail. And I'm not currently involved in that, so I don't want to stir up anything that accidentally. But my understanding is that if they are mission essential, and if they are not having symptoms, that I think they will enter the typical protocol that any essential healthcare provider would enter in, so that there's a proper tracking. And if there's any symptoms that form, that they're immediately pulled. But of course, when working, that they would have full protective equipment that's very strict with additional precautions. And if they are able to do any part of their work via telemedicine, then that's going to be the first option.
Mm-hmm. All right, Doc. Well, did you have anything else for Dr. Cabrera?
No, I just want to thank you for being accessible, Doc. And,
wait, I did have more to ask Dr. Cabrera. I just wanted to give you the opportunity. I wanted to get back to the phone call.
Thanks for
the phone call with FEMA, the listen in, I guess you could say, right? And you were talking about how other areas, I guess, within this region had reported, what's happening in their communities. And how does Guam compare to well, I know CNMI, they don't have any, but you said American Samoa, and I mean, the challenges that we face, are they pretty much the same, or are we facing more severe challenges given the fact that we've got 37 confirmed cases and 4 from the military?
Well, I would say that this is the one situation where we don't necessarily want to be ahead of the curve, but the reality is that we are. And it just happens to be that because we're the hub of Micronesia and this region, and so that comes with the territory, literally. And so but I think that our lessons learned here, and we're learning a lot, and I think it's extremely important that we learn just as much about not what we're doing good, but what we're doing wrong, and what we're making mistakes, and be very quick to admit it, be okay about it, be very, very very forgiving to everybody else, because everybody's working extremely hard. Tensions are extremely high, and people are becoming a little bit more territorial, so to speak, and silos are being brought up. But we're really trying to preach the main message that if you focus only on your own efficiencies and your own department's efficiencies, you make everybody else inefficient. But if everyone focuses on service to each other, service to other departments and other facilities, then you make everybody efficient, and then in the end you're more efficient. So the more that we can be more patient as we get very, very a lot of people are getting very close to burning out, if not already. But if we take a deep breath and really understand that, I think that's extremely important. And I'm speaking not only to my brothers and sisters in the healthcare fields, but I think in every aspect of life here on Guam, and that we this is more so than ever. We have to come together, and we cannot split apart, because that will actually lead to our defeat if we don't continue to work together.
Doc, I just wanted to ask, being a part of the physicians advisory group, I know you guys are in close conversation, and during the first press conference where the governor had showed her hand and said that we're going to extend this emergency, we're going to extend the mandatory social isolation, she had alluded to making releasing further guidance for businesses. I asked her a question about the banks. Because, with the banks open limited hours, what we're seeing is a lot of people trying to go to the bank or whatever, and it's creating crowds. And so she said that there might be a point where she's going to just tell them to close all the way. So what I wanted to ask was...
banking.
Yeah, online banking. But do you think that the governor is going to kind of re-examine some of the exceptions for businesses and maybe release further guidance and maybe put out more closures so that we can... do more to flatten the curve?
I would, I definitely can't comment on what she, would do and what I think is important in terms of that details. That's definitely outside of my field. But I think the reality is that the more and more that we see that the public is not heeding our warning, that the more restrictions are probably going to get placed, and rightfully so, because
Right.
of how because of how serious this is, and if that's what it's going to take, then she'll have to make that very tough decision.
Right. Okay. And does it? I mean, your opinion is that we should do those things already, right?
Well, I think that I don't have eyes on that myself, and I don't know the extent of how bad things are within the in terms of gatherings in that aspect. But it might, like I've been saying from especially this week in pushing that it's not just enough that everybody stay home, that even within the home that we have to do everything to protect protect our elderly, keep our young away from our elders, our manamku. In particular, we have about 800 dialysis patients here on the island. If they all got COVID and they all flooded the hospitals, I mean, you can just imagine what that kind of thing would look like. And that's the problem, that as much as I don't have eyes on the banks, for example, the public does not have eyes on the hospital,
right,
and what we're battling there. And so it's very important that everybody understand that part, and that you may not be seeing it, but it's very real, and it's something that is our probably our greatest immediate threat.
Okay, so give us a visual then of what's happening at GMH, if you could describe.
Well, I in between both GRMC and GMH, because again, I think that we have to really look at both all the time, because you can't look at one without the other. That you're seeing, that we, first of all, you're dealing with a workforce that is already thin to begin with, and now even further thin because of additional hours. Some of them not able to work because they're either being have been exposed, or they have other priorities in terms of their families that they must attend to. So you're already looking at a strained system. You're seeing patients that are going through, and not necessarily just by the nature of having to put on additional protective equipment, that it's not usual care at that point for a lot of these patients, and so because of that, we're constantly having to make adjustments and make decisions about one thing bad versus something that's a little bit worse, and trying to understand that and what that means. And so it does feel like it always feels like it's organized chaos, in both hospitals and in both emergency rooms. But it goes up a little bit. It's definitely a level up at this point.
Right. Well, thank you, Dr. Cabrera, and I think that's all the more reason why people need to stay home. It's not just for your own safety, but it's also you're not overburdening the system over
absolutely.
at the hospitals.
right.
Oh, can I make this one plea to the public?
Yes.
And this is, I think, something we always talk about crowdsourcing help. This is one thing the public can absolutely be very helpful for the people of Guam. And if you are a family member of a healthcare worker, if you are able to help them with their child care, and any way that can get them back on the front lines and help them come back to work, that is a tremendous help, and we really need the public's help in this manner. And again, still following the precautions we said. So this doesn't mean that now grandma starts watching the kids so that mom can go to work. But that's not the right solution. But if auntie can watch, that's not a high risk person, then that's something that we would really, really ask the public's help with, because it's not just the hospitals, it's all the other clinics. Everyone's feeling the same pinch right now and the same burn. And so that's one way the public can really help, is let's please all step up for our healthcare workers and help their families out so that they can get to work. And same way as we would support our troops in the war and support their families, we ask the public to do the same for all the healthcare workers.
Thanks for that, Doc. I mean, that's one of those things that I didn't even think about. You know what I mean? But you're right. Daycare centers non-essential, and so people got to step up.
Yes.
And we're gonna put that out for you, Doc. We're gonna put that on the news today.
Yeah, thank you so much. I really appreciate that.
Oh, thank you for everything that you're doing.
Okay. All right. Well, you take care. Thank you. You guys are doing an absolutely great job informing the public, and keep up the strong work.
Thank you very
Thanks,
much, Dr. Felix Cabrera, of course, from the Governor's Physicians Advisory Group. A lot of info there, very sobering, you know.
I know. Even from the last time we talked to him, I was like, "Oh man." Now I'm like, "Oh my god."
Where could we get an optimistic doctor?
No, but he's keeping it real, and that's what we need.
Yeah, definitely. And, you know, we're making light of it because we feel like kind of laughter is the best medicine, but at the same time, that is what you guys need to hear.
Yeah,
It's
and you
very
need
serious.
to take this serious. I mean, I don't know